joining us. We're going to get started in just a minute. We're just waiting for a few more people to come in from the waiting room. All right. Hi, everybody. Welcome to the second in a series of webinars hosted by the Association of Women Surgeons National Medical Student Committee. Tonight, we'll be discussing mentorship, the value of mentorship, the goals of mentorship, how to find mentors, and how to be a good mentee. And my name is Hillary. I am an MS4 from Penn, and I'll be one of your co-hosts for the evening.
Hey everyone, my name's Nali. I'm also an MS3. I'm from the University of Pittsburgh. Also will be a co-host for the evening.
I think one of our other co-hosts might be having some technical difficulties. But we have Margaret from Canada, and she is also one of our wonderful co-hosts this evening, who'll be helping with questions in the chat.
So I have the great honor of introducing all of our panelists tonight. Just as a note, Dr. Hamad was unable to join us due to a last-minute commitment. But that said, we are so excited and incredibly fortunate to have with us our panelists who are, needless to say, incredibly accomplished women surgeons with an unwavering commitment to furthering professional lives of aspiring surgeons like us. They truly embody what AWS stands for. So without further ado, we have Dr. Kathleen Garcia here with us. She's an assistant professor at the Department of Orthopedic Surgery at the University of Ottawa and senior medical officer at the Ottawa Hospital. She was an inaugural co-chair of the Female Physician Leadership Committee of the Ottawa Hospital and held that position for 4 years. She is a past president and currently national treasurer of the Federation of Medical Women of Canada. We also have with us Dr. Misha Shenday. Dr. Shenday was born in Mumbai, did med school, general surgery residency, and ped surgery in Mumbai as well. She did her general surgery residency and CT surgery residency at the University of Medicine and Dentistry of New Jersey and did an advanced thoracic fellowship at Mayo Clinic. Eventually, she became an attending at Robert Wood Johnson, and we're super fortunate at Pitt to have her here with us. And she works as an attending at UPMC now, specializing in minimally invasive thoracic surgery, chest wall diseases, and reconstruction. And we also have with us Dr. Mara Antonoff. Dr. Antonoff is the Associate Professor of Thoracic Surgery at MD Anderson Cancer Center with clinical research investigating pulmonary metastatic disease, early detection of lung cancer, local consolidative therapy for advanced stage lung cancer, and sex-related differences in prognosis and outcomes of lung cancer surgery. She's additionally engaged in surgical education research as both a previous graduate and current faculty member for the ASC Surgical Education Research Fellowship. She holds leadership roles within the AATS, STS, WTS, IASLC, TSDA, ISMICS, and CTSNet. And she serves on the editorial boards of the Annals of Thoracic Surgery, Journal of Thoracic and Cardiovascular Surgery, Innovations, and Journal of Thoracic Disease.
Thank you so much to all of our panelists for joining us this evening. So before we get started, I just want to make an announcement. If everyone could stay muted and put all of your questions in the chat as they come up. Margaret will be monitoring the chat, and we will be dispersing those questions throughout the webinar as well as at the end. So without further ado, we're going to start. Nali is going to start with some questions about how to find mentors.
So our first question is just in general, how do you search for mentors? How do you ask, and what do you keep in mind during the search? So we'll start with Dr. Antonoff. What are your thoughts?
I know we're going to delve into a lot of these details throughout the discussion tonight about the different types of mentors one might seek and how to find someone that's a good fit for you. But I think in general, when you're looking for a mentor, it's important to consider what you're seeking to find out of that relationship. And when you are thinking about the different types of mentorship you may need, you may be looking for a variety of mentors or more than one mentor. And again, I'm sure we'll talk about that some more. But I think like any other problem you're trying to solve, think about what your needs are, what your objective is, and then search for individuals who may meet those needs. One of the things that we do know about women in surgery is that we can be mentored by many different types of people, but often if we're looking for sex-matched mentorship, we don't always find that at our own institutions. And that can be something that can be hard to find. And some of the unique and kind of novel, innovative ways people have found mentors, especially women seeking same-sex mentorship roles, have been through avenues such as social media. And I've been approached by a lot of people through social media, which I think is an acceptable way, and I received emails. And I think when you communicate as a prospective mentee to prospective mentor, someone you haven't met before, and whether it is through these types of digital communications or whether you're meeting them at a conference, when we have conferences again someday, or if it's in a digital chat room at a virtual conference, whatever it may be, I think it's important to just explain your background, what you're looking for, and why you think that they would be a good mentor for you. I don't think you have to necessarily, provide a laundry list of promises that you're going to keep as their mentee or anything like that, but just to explain, Dr. So-and-so, I really admire your research, and I'm interested in that line of research, and I was wondering if I could interact with you in the future, regarding some of my research questions, or, Dr. whoever it may be, I really, I enjoyed this article that you wrote or this blog that I saw you wrote, and it really related to me, and it spoke to me and some of the problems that I look at on a daily basis. And I was wondering if we could have an ongoing communication. I think just finding some point of connection, letting that individual know why you think that they would be a good fit for you and what questions you hope that they can answer for you in the future.
Thank you so much. That was such a good, thorough answer. Dr. Garcia, we also would love your thoughts as well. You're muted.
Have to unmute, right? Love to talk to myself, but it's not always effective. Okay, so as I said, I think Mara covered a lot of the ground. There is a couple of points I would like to make. And one is, where do you look for a mentor? How do you search for them? And look in unusual places would be an extra piece of advice that I would add to what Mara said. Join an activity, and obviously I'm going to give the example of the Federation of Medical Women of Canada, because that puts you in touch with a whole range of women from across the country. And your chances, I think, go up exponentially to find a mentor or someone that suits you when you've got a much larger audience to look through, or a much larger group to look through. And Mara mentioned that it has to be a bilateral thing, and I think that's very important. And really, I was just thinking of things like, when you speak to the person, you've got to have something, this is a bilateral relationship. It's not, I'm me, I want a mentor, you're going to do things for me. But what am I going to give you in return? And it's going to be a positive experience, a positive feeling. So in other words, I always enjoy ... or you give good advice ... or something as something that you said has spoken to me. But the other thing that I would say is that you don't always have to ask, because sometimes relationships that form organically can be even stronger. And if we want to compare that to other relationships, so, if someone comes and asks me, will you be my mentor? What am I going to say? No. I mean, that looks really poor. But if a relationship is developing, then it's going to automatically turn into that kind of thing. And I think it would be stronger for that. I mean, I probably wouldn't turn somebody down, but we might be a poor fit. So just keep that in mind, organically, letting it develop organically. The other thing I would say, and this is, I think, the perfect place to say it, mentors are wonderful, but you also need sponsors. And it's kind of a similar group of people that you're looking towards. So basically, the literature would suggest that women are equally as likely as men to find sponsors, but 46% less likely, I mean, equally as men to find mentors, but 46% less likely to find sponsors. And I mean, your sponsors are probably going to be a slightly different group. They're probably going to be an older group. It's probably going to be a bigger divide between where you are and where they are in their career. But that's a really, really important piece, because there will come a time when a sponsor can be, you know, absolutely invaluable for you. So, you know, where do you look? Never underestimate the power of your parents' friends, because they actually have a bit of a vested interest in you. So they care about you because they care about your parents. So you've got an automatic in if your parents know somebody who could make a reasonable sponsor or a mentor for you. So, you know, keep that one in mind. And I think that's probably a start.
That's an awesome start. So the next question that we have for you is, when is the right time to find a mentor? And that question I'm going to ask to Dr. Shenday first.
So there isn't one right time. We all need mentorship. So this is not just for the students in the audience. This is for every one of us. We all need mentorship at different stages of our life. So there isn't one time that you need a mentor. As we develop in our careers, we also still have to look up to somebody for guidance, for help, for sponsorship, you know, to get into societies, to get onto editorial boards, things like that. So it's an ever evolving thing. So I don't think there's one time to ask for it. If you're just starting off in the medical field, you know, you're maybe an MS1 or just deciding that you want to do this, well, that's the time to look for one. Start. Mentors, the way I look at it is that it is a little bit of a transactional relationship. This is, you know, we'd like to think of this as kumbaya, but it's really not. It is a transactional relationship. There is a give and take. You are looking for something that somebody has to provide you, whether that is guidance, whether that's introductions, you know, maybe in the future jobs, that can vary. So you do have to keep that in mind too, as to what are your needs for now and who is the person that's best going to help you towards that. The only other point I would make about mentorship is that it doesn't have to be somebody in the same field as you are. It could be a physician, maybe not in surgery. It could be somebody in business. It could be somebody in hospital administration. There are many, many things we can learn from people who are maybe not necessarily surgeons. Even though I know this is a surgical forum, don't exclude those people as potential mentors. They have something to add and teach you as well.
Dr. Garcia, what are your thoughts on when the right time is, if there is a time per se to find a mentor?
You know, I have to agree. There's no right time, and you will probably need different things from your mentors at different points in your careers. You know, when you think about it, when you first got into medical school, you had a whole different set of needs. I mean, some of you may already know you want to be surgeons, but many won't. So you may pick up a mentor and find out that, you know, as your interests focus and as you become more directed, that you need something else. So I think you probably need different mentors along the way, and possibly more than one mentor. I would caution though, if you have too many mentors, you might start getting confusing advice. So, you know, kind of pick them for the thing that you need them for. If you're a resident and you want to talk to somebody about you know, the early career years. Pick a new staff person, pick a young surgeon who's just kind of getting organized. But if you want a sponsor, or you want to talk about the long picture, look for someone with more gray hair, right? I kind of chuckled when Margaret first approached me. I said, well, you know, Margaret, I don't know if you have any idea how old I am. And I graduated from medical school 43 years ago. So that'll give you a little bit of a picture. And mentors weren't even talked about then. But you know, nothing changes, because we had mentors, we just didn't call them that. And you find them along the way, and they find you too, because there's nothing more complimentary than someone who's young and dynamic and intelligent and driven, who's coming up behind you and admires your work and admires what you're doing. It's a positive thing. It is, you know, it's a win-win from both sides. So the young people who look to us for mentorship also feed our rejuvenation. They keep us young.
So the next question we have is, what are your thoughts? I mean, you've already touched on this, but what are your thoughts on having different mentors for different aspects of life? Dr. Antonoff?
I think it's really important to have different mentors for different aspects of your life, because I don't think that any one person is going to meet all of your needs. Just like, you know, many of us will have a wide variety of friends who meet different aspects of our lives. You have somebody you like to run with might not be the same person you like to dine with, because you have, you know, totally different, you know, dietary habits, whatever it may be. And so for me, I have definitely looked towards different people to guide me in terms of my research and my clinical skills, leadership development, personal wellness, sometimes different people for navigating politics, handling challenging situations, childbearing, child rearing. Not every mentor has to be everything to every person. And I will tell you that I met some outstanding surgical technicians who taught me the best way to throw a stitch that weren't necessarily the greatest models of family relationships. And I met some outstanding researchers who taught me really fantastic ways to organize a clinical investigation, but maybe whose leadership skills I didn't necessarily want to emulate. So I think there are aspects you can get from every relationship. And I think, like it was really well stated by Dr. Garcia, I think if you have certain elements that you want to take from each person, think about, what do I really like about that person? What can I get from them? And also, as was discussed, some of these relationships are deliberate, some are assigned, some are organic. And I think you can also find, like was said, you can find mentors in places where you don't expect to find them, and people with whom you are kind of forced to be with, whether that's on a clinical rotation or in a particular research laboratory. And rather than dismissing those people, you can say, you know what, I don't want to ask this person how they think I should potty train my child, but you know what, I'm really interested in how they set up their animal model for A, B, and C, or whatever it may be. And even people, you know, for whom you may not want to be like them in every way, they may have some really wonderful things that they can teach you. And I think just seeing the good in each relationship and what it can bring to you, and what you can, again, what you can give back. And then this was stated, but I don't think it can be overstated, how great it is for the mentor, because most of us recognize that the mentees whom we take under our wing and we teach them, that they are the future of our specialty. And these individuals they may start as our mentees, but then they become our collaborators. And then someday it becomes a reciprocal relationship, and you find that, you know, they're inviting you to do things, and you continue to sponsor them, and maybe they even sponsor you. And I think that as women in this field, and again, I know we're going to talk about all this later as well, the best thing that we can do is continue to support one another and provide each other with opportunities, lift each other up, the people that are ahead of us as well as people that are behind us. So that was a long, drawn out answer to more than the question you asked, but I really do think that different mentors for different aspects of life are absolutely critical, and we just recognize the strengths that each mentor can give us without being concerned about the limitations in other areas where they may not be experts.
Dr. Shenday, what are your thoughts on that as well? Different mentors for different aspects of life.
I said absolutely. That's exactly kind of what I was saying. You take the good that you can from really every person you interact with. And like someone said earlier, you don't have to have a label of mentor, right? You can be mentored without, having a assigned label to any particular person. But yeah, different times of your life and different needs of your life will be served by different people.
So our next question is, what if you're late to interest in a specific specialty? For example, you decide kind of late on that you really love cardiothoracic surgery, which is a really competitive field. How do you kind of build mentorship relationships from that kind of already being late? So Dr. Garcia, what are your thoughts?
Well, it's interesting because it's not uncommon that our interest will follow someone we admire. So it may be the fact that there's a mentor sitting in front of you, and that's part of what helps you make your choice in your direction. So, there may be one very close when you suddenly discover that my biggest passion is orthopedics, and I need an orthopedic surgeon to show me the way. And gee, funny that I know all these wonderful orthopedic surgeons, which may actually be part of the reason I want to be that. But at the same time, they kind of find you the way you find them. And someone said it earlier, and I think it might have been Mara, that not 100% sure on that people in different specialties have different things to offer you. Like, they don't have to be in your area. I mean, you may find some incredibly inspiring person who's been a family doctor all these years. And, they're not going to tell you how to set up your animal models, that's for sure. But, they can tell you a lot of things about how to be and how to behave and how to find your way through the political landscape. And there's lots of things they have to offer. They don't have to be, specific to the one area. So I don't think that being late puts you in a bad situation. And given that you're developing mentors all along the way, you'll pick up more.
Dr. Shenday, what are your thoughts?
I really don't have much to add on what Dr. Garcia said. It's absolutely true. If it is your passion and if you have discovered it late, so be it. You chase after it. That's really what it comes down to. You will find mentors along the way. It might take a little bit longer. I mean, you read my CV. How many years did it take for me to get to thoracic surgery? It didn't hurt me. It made me a better surgeon.
So our final question in this section about finding mentors is, how do you find mentors outside of your own institution, especially for students who might not necessarily have programs within their own institutions for what they're interested in? Yeah, so Dr. Antonoff, what are your thoughts about that?
You're talking to yourself there.
I know, nobody's listening, not even myself. So, and I apologize that we had, I just had a brief little blip there, but you were asking about finding mentors, perhaps external to your own institution?
Yes.
Yeah. So, this is something, it's a problem that we've had, obviously, for quite some time, especially, as potentially as women, where we may not be able to find same-sex mentors at our own institution. But it's a problem that we have really great solutions that are getting better and better. And I think part of our familiarity with telecommunications and virtual communication has gotten even better due to the pandemic. And there are a lot of options and opportunities. And I think that to kind of lay them out, I will say, historically, organizations such as Association of Women Surgeons or the ACS Women in Surgery Group or Women in Thoracic Surgery, Women in Urology, all these different groups are great ways for people to meet others at other institutions. I think they're fantastic means of meeting mentors, and that shouldn't be discredited at all. That's incredibly important. And I think having outside mentors is sometimes helpful if you want just a fresh point of view, or to be able to communicate with someone outside of the current politics of your local institution. You know, there's a lot of different ways, you know, to utilize those different relationships. But, you know, I would say 2-3 years ago, I would also get emails or phone calls from people who would say, hey, you know, I heard you give a talk at such and such meeting, or I heard that you have 4 kids and I was wondering if I could talk to you, whatever it may be. And I would have these phone calls with people. But now that we're all pretty good at things like Zoom or WebEx or whatever your you know, particular choice of telecommunications virtual meeting is, I think there's great ways to interact with people in that regard. And so I absolutely don't think you need mentors at your own institution. I think there's a great benefit to having external mentors. And I'm sure that those of you who know me or have seen me speak or seen things I've written, you probably know that I talk about social media a lot for this purpose as well. I think it's incredibly important. And I think social media, we've already shown that it kind of eliminates some of those intimidation factors and some of the boundaries where people, you know, people are unreachable. You know, people talk about how celebrities are now reachable on social media. Well, you know what, the experts and the great researchers and the people who've accomplished so much are reachable as well. And you can reach them on social media. But then the other element we're seeing with these virtual meetings, if anyone has attended a virtual scientific meeting, that kind of intimidation factor where you may not have wanted to walk up to the microphone to ask a question of someone who's talking about, you know, giving a presentation, because you see somebody who's more seasoned walking faster than you to the microphone and you kind of cower and sit back down. Well, when it's a virtual meeting, it's whoever can get those articulate thoughts out as quickly as possible and who can type them out gets their question answered. So I think a lot of these virtual means of communication, whether it's social media, virtual meetings, they are really leveling the playing field, giving people access to experts. And whereas in the past, you know, I would have said, well, if you want to meet mentors outside your institution, go to national meetings, get a paper on, and then go to the social event and then meet people and then ask them if you can email them later and then make sure you write down their name and their email address. I mean, now there are so many other ways to do that, and you can skip some of those steps of having to go find them somewhere. So I think it's just having the courage and being bold enough to communicate with someone. And I don't think there's anyone, especially a woman surgeon, who would get some sort of telecommunication that that says, you know, I saw this work of yours and I don't have a mentor at my own institution. I was wondering if we could chat. I think people are going to be grateful for that opportunity.
Dr. Garcia, what are your thoughts about finding mentors outside of your institution?
Well, I don't have a lot to add to what Mara said, except it is important to have mentors outside your own institution, because you tend to get a little bit inbred. If you go to school, medical school somewhere, and then you do a residency somewhere, and then, you know, you start to be narrowed a bit in your outlook and how things are done. And, you know, this is the way we always do it. And this is the approach that we always take. And sometimes it's talking to those people from another institution where you suddenly realize, hey, that's completely wrong. That's not, it never felt right for me in the first place, and now I see that it isn't. And not only that, but when you do have mentors from other places, I think it opens up your vistas in terms of where you might want to pursue your career. Not to say that you're not happy where you are, but let's say, you know, you see something, a group that you really admire, and you hear them talk, and maybe you develop a bit of a relationship with some of them. I mean, that can draw you to a whole new place geographically. I do think that you need to join international or national international organizations. I mean, that, you know, it's very glass half full to say the pandemic, what the pandemic has done for us is to fix this whole virtual communication, kind of making us all, the world smaller, and we can all talk to each other more easily. So I'm going to keep that on my list of wonderful things about the pandemic to share with everybody, but it's true. I mean, you know, especially as the group gets older, some of us were less likely to be techie before this, but we've kind of been forced into the whole telecommunication thing. And I think it's been a good thing, because it has improved the communication. So those would be really what I would add.
I will add one more thing to that if I can. So in terms of when you reach out to people through some of these kind of more innovative, I guess, modern strategies, I would encourage you to communicate with the same formality that you would if you were meeting someone in person. So for example, if I get a direct message on Twitter that says, I read this article of yours, I'm really interested in this, I don't have a mentor at my institution, is it possible that we could communicate further? Then I send back a nice reply and say, yes, it would be easier for me if you reach out via email, here's my email address, whatever else. But I've also had, where you get like a random, whatever, Instagram direct message or something where someone just says, with no information about themselves, just, can you be my mentor? And it's kind of like, well, who are you? What are you interested in? What are you seeking in terms of mentorship? And I don't think that anyone would do that in real life. Like, you wouldn't just walk up to someone and say, here's my name, here's where I'm from, here's why I'm here. You wouldn't just say, can you be my mentor? So while I am a strong supporter of all of these kind of new innovative ways to find others and to reach out to others using all of the different types of technological advances that we have, I would suggest that people still use respectful and semi-formal communication in addressing prospective mentors. I'm not sure if others feel the same or differently.
Yeah, for sure.
I agree.
Thank you for those answers. Before we wrap up this section on finding mentors, there was a question in the chat that fits well in this section. And the question asks, can mentors be juniors also? And I'm assuming juniors meaning like junior trainees, maybe junior residents. Please clarify if that's not the case. But I'll open this question up to any panelists that feel like they have something to add here.
And I think we did say, I'll just quickly say, we did say earlier that sometimes there's not a huge age difference in your mentorship or your mentor and your mentee. It's just that that person seems to have a better grip of some aspect that you would love to get some direction on. And, they could be younger than you, but they've just got it together, in this particular area. So I say absolutely.
Do any of the other panelists have anything else to add to this question?
No, I think that's about right.
Sounds good.
You can mentor up, you can mentor down, you can sponsor up and sponsor down. And I think some of the best interactions that I've had have been, when we do find opportunities to learn from our mentees or to teach our mentors. I think that shows a lot of maturity in both sides of the relationship, recognizing that people have a lot to add in both directions. And you may even find a mentor-mentee relationship where you mentor one another in different aspects. You might find a mutual relationship where you say, hey, I was really hoping that you could teach me how you lead teams because I really struggle with that. And the other person could say, sure, can you help me understand how you navigate these difficult conversations because that's not my forte. So, you can even find situations where it goes both directions.
And given now the amount of education that a lot of people have, it can be quite amazing. You may find someone who's coming along behind you who has an MBA. Talk about invaluable, right? So it's just, people have got an amazing experience and a variety of education that can be really valuable.
Thank you guys so much. Margaret, were there any other questions in the chat? Okay, awesome. So we will move on to our next section, which is about maintaining mentoring relationships. And I know everyone has touched on so far that mentorship is a two-way street. So I'm actually gonna pose this question to all of the panelists. What to you makes a good mentee? What are things that a good mentee does? What are ways that a mentee can help further their relationship? So we'll start with Dr. Shenday.
So when I have somebody who approaches me to be a mentor for advice on, stuff, it doesn't have to be medical related. what I expect from that person is a certain level of preparedness, right? So the question that you're posing to me have some thought already put into it. So it can't be that I am going to solve this problem for you. I want to see that you have addressed it and I'm going to help you through it, right? I don't see the job of a mentor as fixing problem for somebody else. I see it more as maybe leading to the solution, or maybe helping choose between a couple different options, but I don't look at it as my job to fix your issues or to give you the solution. So I expect, to shorten the answer, I expect you to be prepared as well with what we are going to address together. The second thing, and this is something I feel very strongly about, is responsiveness. I have had I know we are all busy, right? I'm busy as well as the students that I'm mentoring. But I'll send an email and I don't get an answer back for a couple of days. It makes me not want to continue down that path. If I can take the time out of my day to send you an email, you can certainly read and respond to it. And it could be something as simple as, hey, very busy right now, I'll get back to you in a day or so, but don't ignore my emails. I feel very, very strongly about that. I'm sure there's more, but I'll let the others speak as well.
Dr. Antonoff?
Yeah, I of course agree with the comments made by Dr. Shenday about ways to be a good mentee. I think it's important to be honest. So they can't help you if you're not being honest with them about, what issues are you currently facing and how you're addressing them and what's going on. I agree with being responsive, and I think I would fold into that being reliable. So sometimes mentors will give mentees opportunities, so that's sponsoring as well. But I think, if someone is sponsoring you, you don't want to make them regret it, because mentorship, I'm not necessarily going out of my way other than offering my time, which is still a valuable limited commodity. But sponsorship, I'm putting my name on the line and saying, I believe in this person. This person, is someone that is essentially an extension of my own reputation. If I vouch for someone, so if I provide an opportunity to someone and I'm sponsoring them, I would like them to follow through and show that they deserve that sponsorship. And even when I'm not sponsoring them with someone else, simply giving them an opportunity to work on something with me. Let's say they're like, oh, I don't have anything on my CV. I'm really interested in your specialty. Do you have a research project we can work on? If I'm going to put time into that research plan and help them develop that plan and then have them start it, but then say, I got busy, I'm not so interested anymore. It's important for them to recognize that that's time that I put toward them that could have been spent toward a different mentee or toward a patient care, or potentially even my own wellness and my own family, if we want to place value on those things, which I do. So I always have time for mentees, but it is hard to give time to mentees who don't reciprocate the favor and don't respect our time commitment. And I guess the last thing that I would mention as being important, I'm sorry that there appears to be a small human that has walked into the background. There's a lot of them around here. I would say that the next most important thing is to be open to feedback. So sometimes we hear things that we don't want to hear, that might be hard to hear, but we have to believe that our mentors are offering us feedback because they think it's going to help us in some way or another. So, and with that, I guess I should probably mute myself so you don't hear any more screaming.
I think the only things that I would add to that, and that's a really quite a good list, is be trustworthy. So if your mentor is candid with you, there's a whole lot of things that you can sometimes need to be candid about. Don't gossip, don't pass it around, be the cone of silence, like the vault. This has got to be a trustworthy relationship. And also give some positive feedback. What you said really worked, or this research project is so exciting and it really makes me see the possibility. So you're giving back. So be trustworthy and give back.
Awesome, thank you. So the next question, and I know we already touched on this a little bit already with the changing technology in the face of COVID, but do you guys have any suggestions about what to do if you're not in the same geographic location as your mentor? And so I'll pose that question to Dr. Antonoff.
Yeah, as you mentioned, we did talk about some of those things already. And I think, you know, in terms of, you know, historically, it was just kind of trying to get together with people at meetings. So, and I know right now we're talking more about maintaining relationships necessarily than finding mentors, but still, historically, I would take advantage of those national meetings where I would say that's important for trainees to say, hey, you know, I haven't seen you, but can we meet for coffee for 15 minutes? I know you're very busy. Can we meet between sessions and talk about things? And so likewise, I think, you know, we might not have those national meetings anymore, but I think it's very reasonable just to try to maintain continuity of the relationship. You know, I know Dr. Shenday said we're not necessarily here to like solve everyone's problems, but it's easier to help people stay on track if we have some continuity of the relationship rather than, of course, if there's an emergency or a huge problem, mentors who care about you want to help, of course. But I think if you can try to maintain that relationship using the virtual technology we have, whether it's, you know, contacting someone saying, hey, do you have time for, you know, to do a 15, 20-minute Zoom over, you know, coffee over Zoom, you know, whatever, once every other month, just to make sure I'm still on track or whatever it may be. So I would say just to maintain communication. And even if you aren't expecting something of the mentor necessarily, like if you don't even want to meet with them, if you just want to send them an email and say, hey, I just wanted to update you. I really enjoyed meeting you and I'm still really interested in this specialty. Here's what I've been up to lately. If you have any other ideas of anything I can be doing right now, I'd love to hear your feedback. So I would just say maintaining communication and utilizing the vast technologies we have available to us right now so that you're not a stranger to them.
Dr. Garcia?
Well, I would say the only thing to add to that is try and find out what forms of communication your mentor prefers. I mean, you know, some of us don't text that well. You know, maybe they prefer an email, maybe even an old-fashioned phone call. But if there's something that they prefer, that's a good way to lean and take the time to try and find out what seems to make them respond. You know, if you send them an email and they send you back 2 pages, you've tripped off something. There's some sort of reaction there. You know, so that I think I would say is find out what your mentor prefers.
Thanks, Margaret. Any questions from the chat with respect to maintaining relationships and being a good mentee?
And no questions for this section.
Sounds good. So we'll move on to the next section, which is considerations for non-allopathic and non-US or Canada medical students. And we're super excited because a lot of the students that are joining us here today are international students. And so this will be a really great section. And our first question, specifically for Dr. Shenday, do you have any advice for international medical graduates interested in obtaining a residency spot in the US or in Canada?
That's a tough one, right? Because we know how hard it is for international graduates especially for the more competitive surgical fields. So the first thing I'll say is it is difficult. Be persistent. I can only tell you what I did. I'm not sure that would necessarily fit everybody, but I can tell you what I did. I was already a surgeon when I came to the US, and being a surgeon was more important to me than being in the US. And so that was the first thing I had to clarify for myself. Then the second thing I had to ask and honestly answer for myself is how long would I give to this process of trying to get a residency in the US? And for me, I gave myself a cutoff of 3 years. I did 2 preliminary years before I matched into a categorical spot. So I was willing to put in the time to get a categorical surgical spot. I got it in the third year and I didn't have to go back. But these are very individual, things, and everybody has to very, very honestly ask themselves how they want to approach it. The next thing I did is, mind you, I came here in the era before the internet, so I couldn't go online. I couldn't research online. But the first place I lived in New Jersey, across the street, there was a small community hospital. And I walked into the hospital and I asked to speak with the chairman of surgery. I don't know how I had the balls to do that at that time. I don't know that I have that courage today, but somehow I did it. And for some unknown reason, I got to speak with him. And I told him, this is who I am, this is what I want to do. And he gave me a job as a volunteer in the department. It wasn't a job, it was obviously a volunteer position. And so I would come in and I'd do whatever they needed me to do, around the office and filing papers and stupid stuff like that. But he allowed me to go on rounds with him. And he offered me, after a few months of doing that, he offered me a preliminary position at that institution. But he also wrote a letter for me, which got me a preliminary position at the university hospital, which is what I took. Again, my example may not work for everybody, but the point I would make with that is be bold, be fearless, ask for things, because then they will be offered to you. If you're the quiet wallflower, it's not going to happen. So don't be afraid of rejection. Don't be afraid of being told no, because you are going to hear no more than a few times. But, just be persistent, be brave, and, things do happen. It's not impossible.
Thank you so much for that. Dr. Garki, what are your thoughts? Do you have anything to add?
Well, I have to echo that it is really difficult. I think, in much the same way that people say when it comes to, selling your house, location, 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 I would say elective, elective, elective. See if you can get an elective. Because just like Manisha said, you've got to get in the front door. You've got to let them know who you are, and you've got to give them a sense of your value. And when you do get in the front door, be perfect. You'll be nothing short of perfect when you get in the front door. Even if it means you only get 2 hours of sleep a night, you really need to impress. And don't be afraid to leverage everything that you've got, everything you know, everybody you know. And I mean, actually, in terms of the IMGs, we actually in Canada have a lot of people who go to foreign medical schools because they don't get into medical school here. And they actually don't, it's not necessarily what you think about when you think about an international medical graduate. But some of these kids are the sons and daughters of our colleagues. And they went to school in Grenada, or they went to school in Australia. They already have a bit of a pathway because they know somebody. They know something that they can leverage. And you remember what I said earlier about don't overlook your parents' friends. So, it's just do whatever you can, because it is really challenging. And I mean, the hospitals are even they put up walls. I mean, when COVID struck, we got letters at our hospital offering physicians, foreign trained physicians, to come and look after COVID patients as volunteers, right? And the first thing the hospital said was they're looking for a way in. So it is a real uphill battle. It really is. And yes, be bold, be brave. And I'm really impressed with what you managed to do. It's incredible.
Like I said, we're very fortunate to have Dr. Shenday at UPMC. I'm so excited about that. Similar, so this is another question that's pretty similar, but do you have any specific advice for students of osteopathic medicine? We have a bunch on the call with us today. who are interested in obtaining residency spots in historically MD-centered residency programs. And I mean, surgery is already a very competitive field to begin with. And this question, I think I'll pose to everyone. Dr. Antonoff, do you have any thoughts about how osteopathic students might be able to obtain residency spots in surgical or MD-centered programs?
Yeah, I think ultimately we all have known some terrific DOs who have been in very competitive fields and performed outstanding. And I think the trick is really the same advice that we give to MDs is to really shine in every way. And perhaps there is some conscious or unconscious bias among selection committees regarding the DO versus MD status. And I would say probably one of the biggest challenges that I have seen is simply not necessarily having test scores that we're used to being able to see, like certain test scores or standardized tests, not necessarily the title after the name. But I think outperforming your peers and your competitors by doing a great job on everything you do, whether that's getting great letters of recommendation, whether it's really doing phenomenally well with research, because regardless of which letters are after your name, it should not impact your ability to be reliable, to be compassionate, to be a hardworking team member, to demonstrate leadership skills, to mentor up and to mentor down, to really be productive and academically successful in terms of scholarly activity. And I think don't wear it as a chip on your shoulder. Don't worry about it. Just continue to be the best you that you can, and recognize that, yeah, there are some people, maybe there's some people who are going to look at you differently because you have a DO and not an MD. And unfortunately, there are people going to look at you differently because you're a woman, and people may look at you differently because you're not tall, or because you're this, or because you're that. And I think the best that any of us can do is to embrace our strengths and show everyone what we have to offer, regardless of what other people might be thinking.
I'll jump in here a little bit. At the current hospital I work in, we actually have DO students rotate with us. So they do some of their clinical rotations at one of the UPMC hospitals in Erie, and there's a huge osteopathic medical school. I think it's one of the biggest in the country there. So I get to interact with the DO students quite often. I get to teach some lectures for them as well. They're obviously very smart, they learn the same things, but unfortunately there is a bias still against the DO versus MD thing. And it is a little bit of a hurdle. So, the only advice I can give, and I do give to the students that are interested in surgical fields, is the same as anybody else. Make yourself known. People have to know who you are. So, speak up, be the person who maybe asks questions on rounds, get to know people, ask to be involved with projects, and they could be small projects. I mean, maybe the first thing that you write with somebody or with me maybe would be a case report, right? It's not going to be, a big outcome study, right? But make yourself known as somebody who can reliably get that job done, and then maybe the next assignment would be something bigger, and then maybe that person will write you a letter. Having somebody write letters for you that is in the mainstream, and I don't mean to say mainstream MD versus DO, but in the path that you're looking at, will help you. So just having letters from your DO school versus having letters from somebody who's already in, a surgical attending at the hospital you're working at or you're interested in will make a difference. So I would really suggest getting involved with even small projects. Nothing is really too small to get your name on. I really, think that's important.
In Canada, give it up. It's not going to happen. Ever.
In our group at Pitt, which is about 47, 48 cardiothoracic surgeons, we have one DO attending. And one
The degree is not recognized in Canada, really.
It's not, wow.
Yeah, although it should be, but it's not. Yeah.
Oh, one thing I wanted to add. when we talk about students doing electives, that can be a big problem for foreign graduates trying to do electives in the US. I have tried to help, a couple of my friends in India, their kids reached out to me and they wanted to do an elective in emergency medicine.
It's who you know that counts, right?
I'm sorry? Yeah, exactly, right?
It's who you know that counts.
I could not help them though. That was my caution is at Pitt anyway, and it could be different at other schools. At Pitt, they would not allow me to, or the system would not allow that student to come here and do an elective for various reasons. So sounds like good advice, try and get an elective, but even that can be hard. Even knowing people, that can be hard.
Thank you so much for all of that insight. Margaret, are there any relevant questions from the chat that had come up about international students or osteopathic students pursuing careers in surgery and MD-centered surgery programs?
Yeah, so there were a few submitted questions, and these questions I'll open up again to all the panelists. So the first question asks, as an international medical student, are there any special requirements to be a fit mentee in the US or Canada?
I'll take that. I don't think there are any requirements to be a mentee anywhere. I think anybody can be a mentee. You just have to find the person to mentor you. So I don't think there are really any requirements.
I will make one comment in that I have been contacted by international medical students who have sought my advice, and I have done my best to answer some of their questions, but I have also received specific questions about what's the best pathway for me to accomplish A, B, and C. And I have to admit to them, I'm so terribly sorry, but I don't have personal experience with that. And and let me try to help you find another mentor who may have previously navigated those territories who could help you do that. And so I think that it is important to make sure that that you look for someone who can help answer the questions that you want answered. And so that could certainly be a challenge in terms of asking someone who may not have been down that pathway how to navigate it.
Thank you so much for that. Another submitted question asks, are there any online mentorship programs for international medical students that you're aware of?
Nothing formal that I'm aware of.
Okay, sounds good, thank you. So that was the end of our submitted questions, so we're good to move on to our next section of questions.
Awesome, thank you so much, Margaret. So for our last formal question that hasn't yet been submitted to the chat, we wanted to talk a little bit about when we're in a mostly masculine space, or to take it one step further, when we don't see any mentors who look like us. How do you recommend finding people that we can identify to fill those certain needs of mentorship? And is it okay to ask people who don't look like you and who you might not normally interact with to serve as mentors? So I'll pose this to the whole group. We'll start with Dr. Antonoff.
So I think that's a really important question. And I will tell you that I feel pretty strongly that we do need mentors who are similar to us. And I spent a lot of time trying to prove that I was just like the guys until I realized that I don't need to prove I'm just like them, because it's great to be the person that I am, and I can be different, and that's good enough, and maybe better in some ways. It's terrific exactly as it is. And I did not seek female mentorship until probably way later than I should have. And it was probably in the middle, right in the middle of my cardiothoracic fellowship, that I realized I had no female mentors, and I was struggling because of it. It was a challenge for me as very much underrepresented in cardiothoracic surgery. And in as much as, yes, there are some challenges that are held for both men and women, and, everyone can struggle with some of the same challenges. there were some things that were very specific that I didn't have anyone to talk to, and it was really hard. And I think actually finding that female mentorship was incredibly critical to my wellness and my drive to keep doing everything that I wanted to do. So how do you do it? I think when you find people who are similar to you, whether it be, you know, that you're trying to find someone the same gender, the same race, the same sexual orientation, whatever it may be, you're trying to find someone who you can look to that gives you that feeling of like, I can be this because I see someone who is like me. I think you can find those people in a wide variety of places. It can be in your specialty in a remote place. It can be in other specialties. It can even be women in other fields altogether. I have found mentors in the business world who've helped me navigate some of the gender political issues in the medical workplace. So I think you can really find people anywhere. But how do you find those other women? I think you should be a friend and an advocate in national and global spaces. So don't other women like they're your competition, be a supporter, look out for people. And I think you'll find that people reciprocate. You can volunteer to get involved. And I think this is true for really just any organization. If you are interested in a specific specialty, if you want to be an ENT surgeon, try to get involved in a committee, whatever, a medical student committee for the ENT organization. If you want to find more female mentors, volunteer for a committee with some of the women surgeons organizations. There are so many ways to volunteer for things and get involved and meet other people that you can seek as mentors. And I think you can reach out to women when you hear them give great talks or read their articles or, you know, read their blogs or, you know, attend their virtual conference presentation. Communicate to people and tell them that you really appreciated what they had to offer. And that may, in and of itself, be the start of a relationship, of a mentorship relationship. And I guess the last piece of advice I would have to find women mentors or specific mentors of any demographic would be to seek out specific scholarships. That there are plenty of scholarships that are really founded on the idea of pairing certain groups of people together so that people can have similar mentors. So I would certainly be, I guess, thorough in looking on your internet searches to find those types of scholarships.
Awesome, thank you. Dr. Garcia, do you have anything to add?
Well, I was just thinking, and it was very interesting to hear Mara's comments about how it was such a long time before she found, I think, the female mentor, the women to mentor her. And I think back, and that wasn't really much of a possibility when I started out in orthopedics. I think the year I graduated, I think there were 5 of us in the country, and it was really hard to find another one to develop a relationship with, and we didn't even have all the telecommunications that are present now. So I think you can get mentorship from males, and certainly I know I have, and I did, and I got some very effective mentorship. I think there's a potential, though, for misunderstandings. I think you do have to be very clear, and I think you have to be prepared for the potential of misunderstanding. But I think it can work out very well. And you know, I have some friends that I still have, and sort of mentors that, you know, I had all the way through who were men. But you do have to be a little bit careful.
I would sort of echo what Dr. Garcia said. I didn't have female mentors in cardiothoracic surgery when I started. There were few women, they were not accessible to me. I was in a small program and had really no national exposure at all. So my mentors were men. They still are. I still don't have a strong female mentor in the cardiothoracic field. Has that hurt me? Maybe not hurt me, but there are certain issues that women face that are specific to our gender. And that is very, very hard to solve those problems when, you know, when you don't have other women to talk to. And I'm so, so glad that we have these things going on. Even what we are doing right now, with COVID, I've actually connected more with other women thoracic surgeons than I have in the past decade, which is kind of crazy, but we do regular Zoom meetings now with some of my friends around the country. That has helped, to be able to discuss, job searches, contracts, things like that. Like, there are still things that we face that are different from what the men are dealing with. And so I think having a female mentor is important. Is it essential? I would say maybe not essential. But how do you find them? I think our world is getting smaller. So you can find them and you can reach out. And I know Mara has been a mentor to actually one of my residents right now. And, they connected from across the country, and that can happen. And, you just have to reach out to people and, again, be brave, talk to people, ask them politely, and almost nobody will say no.
Awesome, thank you. Margaret, were there any questions from the chat?
No questions pertaining to this section.
Awesome, then I think we can probably move on to any general questions that might have found their way to the chat.
So there was one question that was submitted. It's not pertaining to mentorship per se, but since we have a little bit of time, I figured I would just sort of put it out there in case any panelists have any insight on it. So the question asks, being 30, do you think it is still possible to be successful in the competitive field of surgery, such as cardiothoracic or orthopedics?
So maybe I'll just jump in here, having lots of age experience. Yes, absolutely. So back in the day, people didn't go into a residency right after medical school. Many of us, well, myself included, did things first before we went back. Now, it was easier to go back then, but it's still, it's not over yet. So, I think you can find your direction, your passion at any point. So if you're 31 and you're going to go and do, 5 years of residency, that's okay. So you'll be 36, 37 when you're finished. That's going to be fine. Lots of people do a lot of front end loading in terms of education. I mean, we get medical students who have a PhD in something, and they truck along and do just fine too. So, oh yes, absolutely. Don't give up just because you're 30.
I was 31 when I started my categorical surgical residency, and I'm still kicking it, so.
Yeah.
Dr. Antonoff, do you have anything to add to that question?
No, I would just totally agree with what the other panelists have said. I think that, if you have to have a clear understanding of what the time commitments are required to get to a faculty position. And as long as you're willing to put that time in, I don't think that there's any biological limitation that prevents you from proceeding with that path.
Awesome, thank you for those encouraging words. There is another question that was just submitted into the chat, and it says, any particular recommendations to build a pathway for peds surgery as an IMG?
I was a peds surgeon in my earlier life, and the only thing I'll say is that it is difficult. Cardiothoracic is difficult, orthopedics is difficult, peds surgery is difficult. Be prepared to spend a few years in research. Try and get into a lab somewhere. That's really going to be possibly the only way really to do it.
And I think that's generally the advice for getting into some of the competitive fields, regardless of where you go to school, is, for some of these highly competitive fields, being prepared to spend a few years doing research is generally a pretty reasonable piece of advice.
Okay, great. Thank you for your answers. So I think that concludes all of our questions for our chat, from submitted to the chat, sorry. I just wanted to ask if any of the panelists have any sort of last words for the students that are with us tonight.
Actually, one question just popped up on my screen. I don't know if you're seeing it, but I think that's something, I don't want to answer it, but I think it's a really good question.
Sorry, yes, I'm just seeing that now. So the question reads, can you speak to the value of a female surgeon mentor as you begin your family and seek work-life balance?
Okay, I'll jump in since you all can see my work-life integration going on right this moment. I think it's actually really important because through my fellowship, I had co-fellows who were fathers, and their experience was different. Their parenting experience was different than my parenting experience. And, you know, certainly it's very important, you know, I think regardless of whether you're a mother or father, there's a lot of responsibility and certainly burdens that go along with that. But I think having people who are having similar experiences is very important. And even if we don't just talk about the differences in like childbearing is clearly going to be a very different experience for men than women, and as well as for people who choose to continue, you know, after having a child. If you have a biological child, then there's the, you know, possibility of breastfeeding and pumping and all that stuff that goes on for however long you choose to have it go on for. So I think having female surgeon mentors through that would have been really instrumental to me at different stages in my life. You know, I have a 13-year-old and 11-year-old, and I had no female surgeon mentors at the time that they were born, and I was kind of like the first one in my surgery program that was having kids. All the guys would go into the research lab and have kids, but the women didn't, because they'd still have, you know, would have to care for those kids after. And so I was kind of like the first of a group of people who did that. And I wish I had people that I could have talked to. And having the third and fourth kids, you know, kind of quite a bit later, when I did have female surgeons who were part of my network and mentors and just almost a support group, you know, it was very different. And I think there's incredible value to that. And I have heard some of the advice that I have heard male surgeons give to female medical students and female surgical trainees about how they should plan their families. And I think it's hard. Some of them are very well intentioned, but it's not the same kind of advice they would necessarily get from women. And I've, you know, I've heard men talk to female students about what their pregnancy would be like and how they should decide how they should plan the pregnancy at just the right time. And I think that there are a lot of reasons why I think women can give each other sometimes different advice than male colleagues can, particularly in this realm.
I was very surprised to hear in my hospital, actually, from a group of female medical students that they had been told by some senior surgical residents, male residents, that they had to choose. They were going to have to choose whether they wanted to go into surgery or whether they wanted to have a family. And I couldn't believe it. I mean, this is just like a year or two ago. And it's, you just kind of wonder how that kind of mindset still exists in this century. I think that I wish when I had been back in that age, I wish I'd had some female mentors. Didn't matter, I had kids anyway. I mean, you know, you do what you got to do, right? But maybe I wouldn't have kind of felt like I was jumping off a cliff. But you know, the thing is that I always tell people, don't try to solve all the problems and get all the answers, because things have a way of, I don't know, solving themselves, or you find a way of, you know, very few people have kids and die. You know, very few people you know, do this and their life falls apart. So things work out. And I think if you feel that you need to solve all those things before you walk down that path, all it's going to do is keep you from walking down that path, and never let it, because things work out.
In surgery, in my life in surgery, I've seen that things work out. They really do. And you know, there are compromises along the way, right? Everything is not always perfect. It's not always exactly how one would wish it would be, but somehow things work out. And you know, that's the light at the end of the tunnel that we all need to see.
I've got kids who are
And I think that
older than many of you. I've got, my kids are in their 30s, and things work out, you know? I hate to admit they're both lawyers. I don't know where I went wrong, but it's, you know, don't worry too much about it.
I do think this is where the value of female mentorship comes in, though, is because I think sometimes, especially when we are talking about things like family, I think women have a clear understanding that, for example, not all pregnancies lead to live birth. Not all babies are born at exactly 40 weeks. You know, understanding of these things, I think, helps women provide advice to other women. Whereas, you know, things that I have seen happen in surgical programs are that people might get penalized or asked to lean out before something has even happened because it's that someone's in their first trimester. So let's take away this opportunity that's 6 months away for this individual because of an assumption that there will be a maternity leave at the exact 40 weeks, you know? And so I think that, especially when it comes to things like childbearing and child rearing, women do provide different advice and a different understanding that things will work out, but you just have to have some flexibility and maybe a network of people who understand the challenges that you're up against and will support you no matter what you need to do as the things do work out.
One thing that I've had to learn is to ask for help. I thought I could do it all. I thought I didn't need help. I thought, you know what, I can handle the home and I can handle the work and I can handle all of this. And it's actually so important to have that village, to have people that you can rely on, to ask for help. I mean, there's no shame in asking for help. There's no shame in having somebody, you know, show up to clean your house or, you know, whatever that help might, whatever that form that help might be for you. But it is okay to do that. It took me a long time to understand that I'm not Superwoman. Like I can give up on certain things and I can say, hey, no time for this now. I'm going to put that on the back burner. And it is okay to do that.
That's such a great point. I totally agree. I did not accept that as early as I needed to either. And it's dumb things like, you know, like I don't need, yes, maybe I can clean the toilet better than other people, but why is that my source of pride? Like there are so many other things that I do well and I could be spending time with people that I care about or working on my own wellness or writing a paper or doing something else if I would just let someone else clean the toilet, or God forbid we don't clean it as often as I have in my head the thought that it needs to be cleaned, you know? So I think accepting help is super important. It can come in so many different ways. Help might be, it might be, you know, outsourcing something, getting your groceries delivered, you know, just literally asking a friend for help or finding ways to, fortunately, you know, surgery is a pathway that at some point you hopefully will be adequately compensated to be able to kind of, there are a lot of problems that you can solve by buying things or paying for things. But when you're a trainee, you don't always have that luxury. But recognize people do want to help. They really do. And as guilty as you might feel, you know, I remember thinking as like a trainee with children, I hated that other people are always having to do stuff for my kids because in the back of my mind, it was, I can't ever drive the carpool. I can never be the volunteer at the Valentine's Day party. I can't do anything. And I felt so guilty all the time until I realized the older we get, everybody's parents are aging, their siblings are aging. Everyone has like a medical question and we answer all those medical questions all the time. And we minimize how helpful we are to those folks. They will gladly help you, you know, with whatever challenges you have if you can provide them with the medical advice when they need it. And so, and the people who care about you, whether it's your friends, your family, your neighbors, they won't say yes if they don't want to. So give them a chance to help you because it'll make them feel good about themselves too.
Thank you so much for all of your wise words to that very important question. I'm sure all of us really appreciated that. So with that, I think that concludes our question period for tonight. Before we wrap up, I just wanted to ask whether our panelists are comfortable with our students reaching out to you in the future after this event. And if so, please feel free to leave your contact information in the chat box here, or you can just pass it on to one of us and we can pass it on to our students.
Yeah, I'm fine with that.
Okay, thank you.
You have my coordinates, Margaret.
Yeah, thank you.
Melly, you can give
I'm
my,
fine with it, and I've just changed my name. You can see I renamed myself my email address, so feel free to reach out to me at that email address.
Thank you. So I also, before we end, I want to say a huge thank you on behalf of the AWS National Medical Student Committee to all of our panelists today. We really appreciate all of your time and all of your wisdom and advice. And to everyone who took the time to attend our webinar today, we want to thank you as well and hope you found our webinar helpful. Just a reminder that this webinar was recorded and you can access it through our AWS YouTube channel should you wish to rewatch it later or share it with your friends or peers. And to the students who wish to learn more about AWS and ways to become more involved with our future events and initiatives, please visit the AWS website, which I will put into the chat box here. And with that, this concludes our mentorship webinar, and I hope all of you have a great rest of your night. Thank you.
It was nice to meet everybody.
It's great
Thank you all
to-
so much.
Bye, everyone. Nice to see you all. Take care.